Does physiotherapy help with prolapse? The short answer is yes, and I'm going to give you more detail in this video. My name's Kristen Norwick. I'm a pelvic physiotherapist and the owner of Karen Physiotherapy, where we are on a mission to empower you to make informed decisions about your health. So if you're finding this video, you may already think you have a prolapse or you may have been diagnosed with one. I know at this stage it can be really scary and really uncertain, so I just wanted to make space for you. Take a moment. I'm sorry that you're struggling with this. I'm also really happy because you found this video and I think I have some really amazing information for you. People develop prolapses for many different reasons. Sometimes there's an incident that you can pinpoint, and sometimes there isn't. That's okay. Everyone is a little bit different. Regardless, if you do have a prolapse and you're wondering, what can I do about it? There are multiple different avenues that you can take. Physiotherapy is what is considered conservative treatment, which means that you are getting treatment for your prolapse without any additional medical interventions, like, for example, surgery. It's really the best case if you can try conservative therapy first before going to the next step of requiring more intervention. Everyone is a bit different, so I would absolutely talk to your doctor about this. However, physiotherapy is that first line of treatment that you can try. I've treated lots of different people with prolapse who have reached their goals and done really well with just physiotherapy and not needed any additional treatment. It's absolutely possible. Everyone is a bit different, but the only way for you to know for sure is to try out physiotherapy. So I'll explain to you what we do as physiotherapists to help with your prolapse. I have the model of the pelvis here. So if you're not sure about your pelvis and your pelvic floor, your pubic bone is the front of your pelvis here. And if you turn around and look at the back, the lower back ends at your sacrum and then your tailbone to your anus. So that's where your pelvis is in your body. If you're sitting, it's the bone you're sitting on. And in between your two sit bones is where your pelvic floor muscles are. So they fill this hole in your pelvis. One of their primary jobs is to support your pelvic organs. So hold the organs and support them when you're doing functional tasks like walking or running or jumping or standing. Those muscles should activate to support those organs. Prolapse can happen whether you have a vagina or a penis. It is more common if you have a vagina. That's the model I have here, so I'm going to show that. But I just don't want you to feel discluded if you do have a penis and you are experiencing a type of prolapse. Physiotherapy can also help with that. I've added the pelvic organs to my pelvic model here: rectum, uterus, bladder. You might not have all of these organs, but that's okay. Generally, this is just to show you where the organs are. They're in this bowl of your pelvis. And they are supported by two major systems. So the first one is ligaments that attach them to the area. And the second one is pelvic floor muscles that are below that help actively support the organs. If you're experiencing a prolapse, your pelvic floor muscles might not be working as well as they used to help actively support your pelvic organs. That's where pelvic physiotherapy comes in. We have extensive training in evaluating and treating your pelvic floor muscles. So we need to know, how well are these muscles activating when you need them? And also, how well are they relaxing and taking a break when you don't need them? That's equally as important and often not mentioned as much. So in order for these muscles to function and support the organs well, they need to be able to contract when you need them, but then they also need to be able to relax when you don't need them. If they're always contracting, and then you ask them to do something harder, like go for a walk, a hike, jump, laugh, then those muscles are going to be more fatigued and more likely to let go and then not support your organ as well. Versus if they are contracting when you need them, but then when you're lounging, maybe watching TV, reading a book, the muscles are relaxed so that when you do cough or sneeze, they're not tired and they can contract, and then your organs are well supported. If that system isn't working super well, that's exactly what a pelvic physiotherapist can help you with. Figure out when you're activating your muscles, how strong they are, how well you can relax them, and if you're using them at the right time for the right things. Sometimes that just gets a little bit mixed up at some point. That can be for a reason that we can't pinpoint, or that could be for a reason such as pregnancy and childbirth. Everyone is a bit different on why it starts in the first place, but we can help with that. We can help figure out where your muscles are at and then give you the exercises and homework you need in order to start using your muscles to the best of their ability. Sometimes that means relaxing them more, sometimes that means strengthening them more, and sometimes it's a combination. I won't know for sure what's going on with you. That's why seeing a physiotherapist one-on-one is so key. You can book with physiotherapists at our clinic to see someone online by visiting the link in the description for this video. Or you can always search out a pelvic physiotherapist in your area. If you have any questions about this or you just want to share your story in the comments below, I would love to chat with you there. I hope that you find some really great treatment through pelvic physiotherapy and that your prolapse symptoms improve. Thanks for watching. Take care.